So, welcome to the Heart of Health Equity. My name is Ashlei Rodgers. I'm the host of this show, and today I have an amazing, dope, fabulous guest today. Her name is Dr. Anu Gorukanti. She's not only my friend, but she's also the co-founder of the Introspective Spaces, and she's also a pediatric hospitalist. Welcome, Anu. Go ahead and introduce yourself.
Thank you so much, Ashley. I am so honored and delighted to be here and to be joining this incredible group of guests that have been on the Heart of Health Equity. So thank you. And thank you for that introduction. So as you said, my name's Anu. I'm a pediatric hospitalist. And basically what that means is I take care of children who come to the hospital, and I primarily care for newborns and babies that are admitted to the neonatal intensive care unit. So I do a lot of really incredible, meaningful work with families and babies. And I also am the co-founder of an organization called Introspective Spaces, which I started with a colleague and close friend of mine, Laura, who is a nurse, and we build reflective communities for women in healthcare.
I always ask all my guests this. What does health equity mean to you?
Oh my gosh, I think health equity means to me a world where everyone can show up as the best version of themselves. And that means that we live in a world where people have equitable access to all the things that would require that access to housing and food and schools and mental health support and community, to have all those things and to live in a society where all those things are kind of rooted in a generosity mindset, and that we live in a world where all children and families can thrive. And I think for me that is such a core value for my work as a pediatrician, is to think about every day when I show up, there's so much about the world I cannot change for the kids that I work with, but I dream every day of a world where these primarily Black and brown kids that I take care of at this county hospital where I work are going to grow up in a world where they're loved and valued and they have access to everything that they need to thrive.
What I like about your organization is that you're like a millennial doctor that's shaking tables and changing conversations about mental health and burnout, especially in the healthcare space. I think it's a conversation that is long overdue, even before COVID, but you've been talking about this for a while now. So can you tell me a little bit about what your organization does?
Yeah, absolutely. I feel like the best way to talk about introspective spaces is to talk a little bit about how it even started to begin with. It's sometimes I wake up and I'm like, I still can't believe I'm really doing this. It feels like such a natural thing, but also such an unexpected deviation from what I thought I was going to be doing in my healthcare career. But I think a little bit about my background. Throughout my medical training, had such a deep interest in public health, and as I went through medical training, kind of was learning a lot about the systemic causes for inequity in the healthcare system. And as I went through my residency training, had this dream to be okay, I'm going to see patients and have the opportunity for one-on-one service, but I also want to be a part of thinking about how our healthcare system works and how do we really work on dismantling systems of oppression. And as I went through my residency training, the amount of moral distress or the amount of situations I found myself in where I knew the thing that I wish could happen, but felt powerless to change it, was increasing more and more every single day that I was at work. And by the time I finished my medical training, I wasn't sure anymore if I wanted to practice medicine. And I wasn't sure if there was a space for me where I felt like my values of generosity and compassion and justice could be reflected. And as I started out my career as a physician in the pandemic, I was trying out a few different jobs to figure out if there was something for me. And I had the opportunity to continue chatting with my friend Laura, my co-founder, and we just found that we had so much in common. From her from the nursing perspective and me from the physician perspective, talking about the situations that cause us a lot of distress, seeing inequitable care, feeling like we had to go to work and shut off our emotions. We couldn't talk about the things, the different parts of our identity that were super meaningful for us. And for both of us, we came from really different spiritual backgrounds and felt like having conversations that where we could bring all the parts of who we were so necessary to keep showing up for the patients that we were serving, but it just wasn't a part of our day-to-day environments. And kind of through our conversations, we were like, let's just host a reflective retreat for women in healthcare was during the pandemic. Most of us were super isolated and wanting community. And from that experience, we had this incredible gathering of women from all over the country in so many different healthcare professions, from chaplains, nutritionists, social workers, physicians, nurse practitioners, nurses, who all came together and found that we had so much in common in our shared experiences, that we wanted to be able to do so much for the patients we served, but because of the way the healthcare system was, we just didn't have that opportunity. And it felt so meaningful to be in community with each other. And from that experience, Laura and I were like, we love this. We love creating these spaces. These are spaces that we wish we had. And that's kind of what led us to starting Introspective Spaces, and has led us on this year-long journey of hosting so many different types of events and retreats, and trying to figure out how we can best serve women in healthcare, how we can best find spaces for healthcare workers to show up in their authentic selves, and to know that creating those spaces for reflection, to be able to tap into our inner space and to do that with other people, is how we can best show up for our patients, even in a broken healthcare system.
I love that, because like you're being innovative. So when you're being innovative, you don't really have, you're kind of winging it, but you're not. You're being intentional about winging it. That's like an oxymoron.
Yes,
You're intentional about
1,000%.
what you're trying to do. Yeah, I believe in I believe in everything that y'all are doing. There's such a need, and not to take us from a high to a low, but I know we talked about this privately. We were talking about like physician burnout and like how important it is for us to have these conversations about mental health. And just recently, there was a National Physician Suicide Awareness Day, which is September 17th for
Mm-hmm.
recording. And I feel like when that day came up, and there was also the news for the girl Jean Mai, who was incredible from everything that I've heard about her. She was basically a first-year resident at UC Davis who recently committed suicide because she was under so much pressure. And even though she was vocal about her struggles with mental health, it wasn't enough. When her story came out, it was trending on Twitter, and a lot of people were talking about it online. Um, I heard a lot of doctors, attendees, interns, whoever, saying, I relate to her. I have been in a space where it's been very, very dark for me, where I was dealing with severe anxiety and depression because of the training or because of like the culture, working in the hospital system. And so you're creating the space where people can feel safe and vulnerable and talking about it. But what can we do as a society to help create a space for doctors to feel safe, or nurses or CNAs or whoever to feel safe when they're dealing with anxiety and depression because of the training or because of the environment of working in healthcare in general?
Yeah, thank you. Actually, I think that's such a good question. I feel like Dr. Maya's story is so devastating, and
It's
I
horrible.
just feel so much for her family and all her loved ones. I think there's, and I feel like from my own experience navigating anxiety and like actually having acute stress disorder in residency, in terms of like the medical culture, there is a lot of stigma still around accessing mental health care, which to me is, it feels so crazy, because as providers like and clinicians, like we recommend mental health care all the time to the patients that we serve. But within the medical community, there's such a fear around like people knowing if you have anxiety or depression, fear about like, will it impact my ability to be hired for jobs? But I'm very, very open about my own anxiety and mental health journey, which I try to do so that people know that they're not the only ones navigating it. But even with my colleagues, when I talk about seeing a therapist, there's a lot of anxiety and fear around, are they going to disclose this information, which they do not. But I think even within the medical community, there's a lot of misconceptions and a lot of fear around like, what if people find out? And that is such, I think, an injustice to trainees, to physicians, to be able to receive the help that they need. And it's one of the reasons we actually did a big push in May for Mental Health Awareness Month. And Laura and I both shared a lot about our own journeys, like of navigating our mental health experiences. And I think there's so much room for dialogue and vulnerability around that. And I think systemically, it's very hard for people to access mental health care, as it is for anybody in this country. Like, just like the resources and opportunities, even for myself right now, having moved and have a new insurance, like, I anticipate spending probably at least 30 hours trying to access and find a mental health therapist, which is a huge privilege in my to have insurance that covers it, to have the time and space to even look for a therapist. So I think there's just so much like from an advocacy perspective of like increasing access to mental health care for healthcare workers and for patients, shifting the way that we communicate and talk about mental health within training, normalizing that it should be an expectation. My dream is that like all healthcare workers have access, and it's kind of a part of our cultural expectation that we see mental health services because we see really traumatic things, and to have spaces to talk about that and name that as like an expectation of our job like would be amazing. But I think
That
there's
would,
still a long way to go.
yeah, I think I wish that more people felt safe enough to have this conversation about mental health. We talk about all other aspects of healthcare, but not our mental health enough. And I have a question as a physician, and hopefully you haven't experienced this personally, but I know it happens obviously in healthcare. When someone dies, like if someone's had a patient for a long time and they've died, or it's really traumatic, or whatever happened, what happens the next day? You just have to go to work. Is there not like a pause? Is there ever that kind of conversation that's had in healthcare systems, or no?
Yeah, not always. I mean, sometimes we're able, depending on kind of who's leading the team, kind of the structure of the day, like you may be able to pause and like have a debrief or like to bring together all the members of the team to talk about how it impacted you. And oftentimes we'll have chaplains or palliative care team members or social workers available. But I think that was for me one of the greatest sources of distress during my training is that
Really?
I would have patients die like in the middle of the day and I would just have to keep working. And I think there's one experience I had as a working physician where, and I'm just going to name this is for those who, um, from talking about children and their medical problems is triggering, I would maybe recommend pausing this part, but or skipping over it. But during one of my times working in the neonatal intensive care unit, I had a patient where the family was withdrawing medical care because we had learned that this patient would not be able to survive kind of the medical issue that they were navigating, and they wanted to do it in a way that was surrounded with family very compassionately. But it was something. It was. I'm thankful the family was able to be there, but it was so devastating. Like it was just awful to be in that situation and to be holding space with that family. And I definitely like felt it since I had gotten to know that family. And basically, we left the room, and then I was like, there was like not really any acknowledgement, and so I just had to keep going to work and take care of my other patients. Like the work never stopped that day. The way that it was our healthcare system is structured is there's just not enough time and space for people to get to tap into all the different parts of who they are. And I think it's a huge component of burnout and moral distress that people don't have time and space to acknowledge the humanity and the things that we bear witness to and the suffering that we see every day at work. And sometimes people just get numb to it because to be able to be in that emotional present space takes a lot of emotional bandwidth.
Yeah, it's a lot of energy to take that on because the average person can't handle it in their own personal life, but seeing it every day as you're going to work for years and years and years. As we're talking about burnout, because burnout is, usually there's signs before you actually officially burn out and have like a whole like panic attack, or like you're just kind of like, I can't do this anymore, and you quit. Um, for those who don't know the signs of burnout in the healthcare space, can you give a few examples of their so they can kind of notice what maybe what's happening to them or someone that they love before it gets really bad?
Yeah, absolutely. I think that burnout can manifest in so many different ways, and I can speak maybe to how it looked for me. Like as I was navigating my medical training, I felt like for me there was components that were both physical, mental, and spiritual for the way that my burnout manifested. Like physically, like I felt physically nauseous a lot of the time and very anxious before going to work. Like sometimes having like changes in mood, feeling really irritable or frustrated or angry, sometimes not even understanding like the emotions that you're feeling can be
Mhm.
signs of burnout. And I think for me, from a spiritual health perspective, like I just felt a lot of distress and anger. Like I felt distressed that I felt I was coming to work and feeling like I wasn't living my values, like I was maybe doing things I disagreed with and didn't feel like I felt powerless. I felt oftentimes like I was like just like searching for like space to process and I didn't have it. And I think it just like led to me just feeling like really emotionally dissonant, and not able to like really connect and even just be with other people. So even the times I was there, I didn't feel like I was always very present. And so I feel like there's so many different variations of how that can look for other people. But I think just like knowing that it can manifest in a lot of different ways, and sometimes we don't even know what those are, even though that's vague, I think can be helpful to know that it's really different for different people. And sometimes we can seem like we're functioning really well, that we're going to work, we're doing all the tasks, and even despite all that, we can still be really struggling on the inside. And I think that is one of the challenging things about burnout is sometimes we're not even aware until it manifests in a really extreme way.
That is facts. That is facts. Okay. And I like to switch gears just a little bit as we're talking about culture and we're talking about mental health. Um, and we both have experienced mental health struggles, but we're on top of them. Um, can we talk about culturally? Because you're of Southeast Asian descent, right? Like you're Indian American.
Hmm.
And so I know for Black folks, talking about depression and anxiety, mental health in general, is a lot of stigma. We don't talk about it. And if we do, it's only because it's extreme or it's a whisper type conversation, which is something I'm hoping that through these type of conversations we can change. Do y'all experience the same thing in the Southeast Asian culture when we're talking about mental health? Do y'all talk about it, even though there's a handful of folks that are healthcare professionals? Still, there's stigma. So like, what's the vibe? What's the vibe for your community?
Oh my gosh, so much stigma. There's so much stigma in the
Yes,
South,
happens to all of us, yes.
yes, in the South Asian, Southeast Asian communities. Like there is just such a, and I think a lot of it, I feel like there's probably a lot of nuance to it, like whether you're, I never know if it's first or second generation when you're the generation that grew up here. But
Yeah.
oftentimes there's a lot of cultural differences with how our families grew up and like their conceptualization of mental health. At least I can say in India, like there's maybe more of a national discourse around it, but in my parents' generation, there really wasn't. And so when they come to the US and many of us grow up here, there's like a lot of difference in terms of like our vocabulary, our ability to talk about our feelings that many of our families just like did not grow up with in general. And so I think like talking about mental health can be hugely stigmatizing. And I think for a lot of my colleagues, many of whom are Asian, South Asian, who are navigating the mental health issues, they may not feel safe talking about it with their families, which can be really hard because families historically and ideally are a huge source of support. But there's still so much stigma. And I hope by people sharing their story, kind of naming that mental health issues impact so many of us, kind of giving people vocabulary to say, oh, yeah, like when you wake up in the day and you feel really sad all the time, like that those could be because of things like depression or anxiety. Like there's actually names and reasons and like things that you can do about it. I hope that over time that becomes like language that's more natural to people within our community. And I think also having like more folks of color in all these spaces, like in the mental health space, as physicians and nurses, and in every healthcare space, to be able to be one saying like, hey, like this is what it's like in our community, but let's be the ones talking about it and creating these spaces, I think makes a huge difference.
I agree. I think that there needs to be more representation in the spaces because it's different when you can talk about your culture without talking about it. You know what I'm saying? Like you can talk, if you can talk to a physician and they already get all the other background nuances of your culture. And you don't have to like explain things as you're explaining things that are happening in your family or like happening in your
Yes.
community, like they get it. That makes a huge difference. And then also like I have to say there's like no shame in the medicine game. Like if folks are struggling and they need to take antidepressant,
Oh,
antidepressant, I can't even talk right now, antidepressive medication or like anti-anxiety medication or whatever type of medication you need, take it because a lot of times it's a chemical
yes.
imbalance and it's like you're fixed up. It's like a patch, as my mom says. Like as you get older, it's just a patch, backlash and it's fine. So I appreciate the candidness about that because I don't think enough folks talk about that. How do you have those tough conversations about racism and inequality? Because you've seen it from different facets, not only being, you know, a Indian American in a rural town, but also seeing rural versus city and like how that inequality happens, right? Too. So how do you have those conversations, like from your perspective, and I guess for others as well? Like, what's the vibe?
As I think as an Indian American, I was in this like weird privileged space where people had just never met anyone Indian. Like I was the first person they had ever met in real life. And so I think people didn't have any preconceived notions of what I could or couldn't do, who I could or couldn't be. And but I was very identified by being Indian. Like people would, would very much ask me like, where are you really from? And like couldn't really conceptualize that I was born in the US. But I think it gave me this interesting platform that I reflect on, I take very seriously, where people would talk about their own racist viewpoints in front of me. And I would use that my experience as an opportunity as a chance to be like, push back and be like, why do you think that? One of the roles I think for people of the South of the Asian community that we can play is like many of us have experienced our own versions of microaggressions. And I think from that we can have like micro empathies, I like to say, because it's not the same as the systemic oppression of Black, Indigenous, Latinx folks in the US. But I think it kind of we are called to be in constant solidarity and to think about how do we use the spaces in which we have privilege to continue speaking up about this.
I just want to say thanks for fighting the good fight for folks that look like me and beyond, because it's true. You're in spaces that you don't experience the same level of racism, but you do experience racism. For you, what does it look like to build a safe community of folks who will they feel like they can be vulnerable and talk about their mental health where they've been forced to be strong for so long?
Yeah, thank you. That is my favorite question. I think
I
community.
know you love the community. Like your
Oh
thing.
my gosh. Yes, I think community and community care is just one of the most fundamental components of well-being. I think for me, like the isolation of feeling like I was the only one who's struggling and navigating some of the things I was witnessing alone was one of the hardest parts of the whole experience. And I think finding spaces to be with other people without any even the intention to fix or even problem solve, but just to be and to have the presence of each other, I think that in itself is radical and healing and amazing. And I think also to build a community where people can show up authentically, it takes trust and it takes time. And I think for Laura and myself, like every time we host a community space, so much of our time is spent building kind of the vessel for the community that we're going to have each day. Even if the session is only an hour, like what we do is like really try to show up as authentically and vulnerably as we can and to say like this is like how we're showing up in this space. We invite you to bring in the commitments and values that you have. And we also always begin by giving people like a space for grounding in their physical bodies. And so we start all our events with either breathing or body scans or something to kind of help us kind of slow down and like be in the present moment, which is something that we don't usually get to do in at our workplace. And also we spend a lot of time getting to know each other. And my favorite question, which if anyone has ever come to an event I've led, is to ask people what they're proud of. And I think it's just amazing to hear what people share. And sometimes it's something really small, like, oh, I loaded the dishwasher today. And sometimes it's really big where they're like, I felt like I was able to come to work and be the person I wanted to be. And whatever it is, I think having that space to acknowledge like we're these multi-dimensional, multifaceted people.
I love that. And I love that question. So what are you most proud of now? Like let's have our little mini community section right now. So what are you most proud of today?
Oh my gosh. Well, thank you. That's such a nice question. So I think for me, what I'm most proud of is I'm so grateful that Laura and I are still here. That every day we show up and we are trying to build a company basically rooted in the values that we wish healthcare institutions had. I'm happy and so proud of us that we're still doing it, that we're living this uncertain life, but it's such a gift and privilege. And I've met incredible people like yourself in this journey. So every day I'm grateful to do what I love. And I feel like just like in the spirit of shared vulnerability, Ashley, I'd love to ask you what you're proud of.
I feel like today I'm most proud of this show because it was a concept that me and Katie, the producer, came up with, and it's become something really great to be able to elevate voices like people like you, and having those uncomfortable but very necessary conversations about all things healthcare and health equity. And so I appreciate this show and having the conversation with you about mental health, like having an honest conversation about it, because I think it's not happening often enough. So that's what I'm proud of. I'm proud of that. Yeah. So thank you for asking me that. So how can I hear from you? Like what's your website? Do they find you on Instagram, email, LinkedIn? What's the best way to get to you?
So, the best way to find out what we're up to is signing up for our newsletter, which is you can just sign up for on our website at www.introspectivespaces.com, which you can also just Google Introspective Spaces. We're one of the few websites that pop up on there. And you can also find us on Instagram at Introspective Spaces as well as on LinkedIn at Introspective Spaces. So we'd love to hear from you. We're always so excited to connect with other healthcare workers and really, really open to collaborations. I think that's something that's a really core value for us.
I can tell you that Anu is one of the best people I've ever worked with. Like she's amazing. I haven't met your partner yet, but she sounds dope as well. And so I highly recommend y'all contacting them. And yeah, I want to say thank you so much for coming on the show and like being vulnerable and providing a safe space and community for us to have these genuinely honest conversations. If you guys are interested, definitely check out our organization, Introspective Spaces, with the website below. And yeah, thank you so much.
Thank
Bye.
you. Bye.